Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on COVID-19 for the week of October 19th, 2020. I'm going to try to combine all of my presentations into one to make them quicker and perhaps more useful. The numbers are pretty straightforward. Almost 40 million cases, 1.1 million deaths worldwide, 8 million cases, 223,000 deaths in the U.S. The U.S. accounts for almost exactly 1/5 of both the cases and the deaths. This is a top 20 pandemic in recorded human history in terms of total deaths, and as of this month, is still the third leading cause of death in the United States this year. But what I really want to talk about today is how do we know when we're getting to the end of the pandemic? How will we know when we're coming to the end, that we can start planning on things returning to somewhat normal? The reason that's a tough question is if you look at this growth rate over time, you can see that it looks like a straight line. It's gone from very few deaths worldwide in the early part of the year all the way up to well over 1 million. But what's missing from this is the realization that actually the week-to-week growth rate has been slowing down. So back in early April, 60%. That means if you had 100 deaths one week, you'd have 160 the next week. And then it dropped pretty quickly down to about 10% by May and has been slowly dropping ever since, such that this week is 3.4%. Well, why is that worth watching? Because you can tell if week-to-week growth rate is very slow, like very small, like some of these numbers here, it takes a long time to double, and essentially the pandemic is coming to an end. You're going to burn itself out one way or the other. This is what it shows graphically. And so at 3.4%, the number of deaths in the world will hit 2 million in about 18 weeks, and will double in about 21 weeks. Now, what we're hoping is that as the growth rate slows, we're seeing the end of the pandemic. So take a country like Belgium. It was the most heavily impacted country in Europe in terms of death per million. No, not many deaths early on, and then March and April, it just skyrocketed. And then it stayed essentially there. So if you look at the percent week-to-week growth rate, it was over 100%. It was doubling every week in April. And then recently, as late September, about a month ago, was well under 1%, where it has been for several months, telling us that at that point, that wave of the pandemic is coming to an end. The U.S., on the other hand, has been coming down, certainly, but is still not where Belgium is, though it's a little bit better than the rest of the world, suggesting that the U.S. is moving towards a mature pandemic, but isn't there yet. And in our case, this is probably because the disease continues to spread in parts of the country that it hasn't previously hit. At 2.3% week-to-week growth rate, the total number of deaths in the U.S. will hit 300,000 in about 14 weeks and would double in about 30 weeks. But of course, if the number keeps coming down, it'll take longer. If it goes up, it'll take less time. Virginia is about where the U.S. is. Tennessee, on the other hand, is not. So this tells me that the pandemic in Tennessee is still early on, still growing quickly. And if you look at our region, if you level out all this week-to-week change, you can see that it's still coming down, but again, not as low as we'd like it to be. So clearly, for the Appalachian Highlands and for Tennessee, the pandemic is earlier on. It hasn't reached the mature phase. Virginia is a bit like the rest of the U.S. The U.S. is better than the world overall, but not as good as countries like Belgium. Tennessee's had almost 3,000 deaths. Virginia has over 3,000 deaths, and our region is approaching 1,000 deaths. So, are we getting close to the end? Well, again, if you look at Belgium, there's something that's going on that's a little bit concerning. And that's right there at the end. You can see just in the last few weeks, there's been an increase from that 0.2% week-to-week growth rate to almost 2%. Now, what we don't know is whether this is sort of exaggerating that trend to show that after several months of being less than 1%, it's shooting up. Now, this is something that we're seeing in all of the European countries, at least all the ones that were heavily impacted early on. Nothing like the number of deaths we saw early in the pandemic. But nonetheless, this trend upward is worrisome. This shows the number of cases worldwide. Those in dark blue are Europe. And you can see that it's coming back to be a major player again. Now, what we don't know is whether this week-to-week growth rate in Europe is something that's very important or not. Is it a sign, simply a sign of opening up? You know, they were shut down so much that now new populations are being exposed. But there's two possibilities that we need to pay attention to. One is that there may be mutations in SARS-CoV-2 that's causing new deaths, or it could be the infamous new wave of infections. We don't know which of these is contributing to that increase in deaths. It may not be significant, it may be, but it's certainly something worth watching. This problem is made worse because we now also know that there have been people in several countries who've been reinfected with SARS-CoV-2. In other words, they had it, they got better, and then they got infected again. We don't know what that means in terms of immunity, but if it means that natural infection doesn't give you immunity, then there are very real questions about the development of a vaccine or herd immunity. So again, these are important trends that we have to keep an eye on. So the bottom line is COVID is still spreading, though the growth rate has slowed down as we would expect. 5 of the top 10 countries are in South America, with Peru being the most heavily impacted country in the world right now in terms of deaths per million. The U.S. is still in the top 10 with about 2/3 the deaths per million of Peru. There appears to be a slight resurgence in deaths in the European countries that we definitely need to keep an eye on. We also have some questions about long-term immunity. For the moment, we know the things that we need to do, right? We need to avoid crowds. We need to wear masks, engage in social distancing, practice good hygiene, stay home, good contact tracing and testing, quarantine and isolation, protect the elderly and those with chronic disease. But perhaps the most important thing we need to do is we need to keep following the data and change our thoughts and actions as new information is available. If it turns out that this growth rate in Europe is insignificant, that it's just a exposure of folks that were otherwise protected, okay, that's fine. But if it represents a resurgence of the pandemic, then we really have to understand that we have to change our bottom line. So right now, the basic information is that the pandemic appears to be slowing down, as it has been for some weeks. However, we don't know what the long-term implications of that are or whether that's going to change. A lot more information on our website. If you'd like to have folks added to our mailing list, please let us know. Thanks as always to Melissa White for updating these slides and Dara Young for editing and producing and posting them. And as always, if you have any questions, comments, concerns, uncertainties, please let me know. I address most of your questions directly by email, but some of them I do add to this weekly update. I look forward to hearing from you. Thank you very much.